Have you ever wondered how we describe the position of different parts of our body, or how we explain the movements that our body makes? Well, there's a whole language dedicated to it. Let's delve into the world of anatomical terminology. First, let's begin with terms of position. We have anterior and posterior, or ventral and dorsal. These terms describe structures at the front and back of the body respectively. Picture this: your toes are anterior to your heel. Next, we have superior and inferior. These terms describe a position above or below another part of the body. For instance, the pelvis is inferior to the abdomen. Then there's proximal and distal. These terms describe a position that is closer or further away from the trunk of the body. For example, the shoulder is proximal to the arm, and the foot is distal to the knee. Superficial and deep are used to describe structures that are closer or further away from the surface of the body. For instance, the skin is superficial to the bones, while the brain is deep to the skull. Lastly, there's medial and lateral. These terms describe a position that is closer or further away from the midline of the body. For instance, the nose is medial to the eyes, and the thumb is lateral to the other fingers. Now let's move on to terminology of movement. We begin with flexion and extension. These terms refer to a movement that decreases or increases the angle between body parts. Abduction and adduction refer to a movement of a limb away or towards the medial line of the body. Elevation and depression refer to the movement of bones toward the upper side or lower side respectively. Dorsiflexion and plantarflexion refer to the decrease or increase in distance between foot and leg. Finally, eversion and inversion refer to movements that tilt the sole of the foot away or towards the medial line of the body. In summary, we've covered the key terms used to describe the position and movement of our bodies. We've learned the difference between anterior and posterior, superior and inferior, proximal and distal, superficial and deep, and medial and lateral. We've also explored the terms used to describe movement, including flexion and extension, abduction and adduction, elevation and depression, dorsiflexion and plantarflexion, and eversion and inversion. These terms are the building blocks of understanding anatomy and describing bodily movements. They enable clear and concise communication about the body, essential for medical professionals and those studying human anatomy. Remember, every term has a specific meaning and application. Understanding them can provide a deeper insight into the wonders of the human body and its movements.